Once you get the biopsy back, at that point, there is you come to grips with the fact that you do have this disease.
It's like being hit on the side of the head with a 4x4. It was just a very sobering experience. Nothing else in the world mattered. All of a sudden, did I have a life and death issue?
I think when you get you are diagnosed with cancer, it's scary.
I'd be hard-pressed to understand how anybody could go through this and not be afraid. The doctors told me there's a way out of this. You just have to approach it and say, what am I going to do about that, and how am I going to go forward?
That's a diagnosis that I had. I can't do anything about it. All I can do is improve on the situation as it occurs, and the only way you can do that is to be optimistic.
I went to a movie that afternoon, thought I'd, after diagnosis, and thought I would think it over.
I sent an email out to about 50 friends and said, I have been diagnosed with prostate cancer, and I want you to be aware of it, and da-da-da-da, here's what's going on.
I was quite concerned about how other people would deal with my diagnosis and so on. Would they become unglued? Would they become hyper-emotional? Would they suffer?
My wife was involved from the beginning. I didn't tell the rest of the family until I knew what it was.
My wife knew, and I have 4 boys, so I told them just to alert them that they might have some concerns down the road.
Don't be quiet about it. Talk to your friends about it, and you might be surprised at how much support they'll give you. Take a deep breath and try to get some perspective on it. Have a chance to talk to your friends who surprisingly may have already had such prostate treatment without your even knowing about it. I found a few friends of mine that almost came out of the woodwork.
You're stuck with this decision of what do I do, and you're on your own, and you've got to make that decision, and that's a hard thing.
I have quite a few contemporaries who have been through the process or were facing the same decision. I talked to them, and you could go around and around with a number of different treatments, and I just determined that I trusted my doctor and the people that I've met here, and I thought this was the way for me to go.
He said, those are the alternatives. Take a look at it and think about it, and then talking to other people and seeing which steps I had to take.
I had talks with first a surgeon who did the traditional prostate surgery, and then a radiation specialist, and finally the fellow who did my laparoscopic stuff, as well as a doctor, a urologist, an oncologist.
What I was looking for was statistical analysis that was saying, these are my odds, so I can focus on it and learn what these terms and numbers and ratings mean to give them a more realistic approach to making a decision.
I figured, I'm not a cancer expert, I'm not a surgeon, I don't know anything about drugs, I don't even want to know. I gave all that worry, that thought, that analytical concern to him, and I said, okay, well, what do I do?
Not doing anything was not an option, so I had to do something, and so the question is, what are you going to do?
I waited 2 years, thinking that if I bought time, it would go away. Well, it did not go away.
Why wait? Wait is not going to do you any good. I mean, all you're going to do is build up anxiety, build up apprehension.
There's a lot of people out there that have gone through this process, enjoyed this ride, and you find other people that show up and say, yeah, okay, I understand.
I don't see any reason to wait. Once you're diagnosed with this, I probably made a mistake in waiting the 2 years.
I started studying. I started talking to people. I talked to doctors. I read it on the internet.
There is a lot of information on prostate cancer, a lot of information on the different ways that you can treat the prostate cancer.
I actually went on the Johns Hopkins website. It was written in such a way that the layman can understand it.
Make a decision based on the knowledge available to you and your gut feeling. That's a big part of it.
What your doctors give you also is, a lot of good information. And I think helps in the decision making. We, the individual, have to make that decision ourselves.
He just answered all my questions, was very patient, told me to take my time, and if I had more questions, come back to him.
I could ask any question I wanted. I never felt like I was asking a dumb question, or if I asked it 2 or 3 or 4 times, they didn't seem to mind.
You don't know what's going to happen. If somebody tells you that is going to happen, expect that, don't worry about this issue, it's not just the word from the doctor.
It's really important to formulate a plan, and I think that was one of the things that I had in mind when I selected radiation, is that I would not be laid up for a period of time.
For me, the choice was surgery, and that has its side effects. The recovery is long, it's slow. It takes patience.
In mid-afternoon, after the early morning treatment, I just didn't have as much pep as I had been having.
I had the feeling that this was the guy, because he seemed to have it all in hand, and it offered me the best opportunities for least time in the hospital and least side effects.
Once we started, the routine of coming in for 5 days a week for 9 weeks became a totally normal, natural process.
Once I started the treatment, it was a cakewalk. I mean, it was just really no problems, no anxieties. We're going to lick it, and we did.
Humor is a big factor in all of this. Dropping your trousers before a third party every morning at 7 o'clock is not the easiest thing.
I had an appointment about 8:30, so right after breakfast, I just came right over here. And it was over before I knew it, and I was back in my apartment by 9 o'clock, ready for the morning newspaper.
I had my radiation first thing in the morning. I was at work by 9:30, 10 o'clock, and had absolutely no problems at all.
I exercised every single day until the day I had the operation to make sure that I ate correctly, and I exercise every day to say, the day I go to the operation table, I want to be physically fit, if I can.
I think I grew to appreciate life maybe one step more.
The overwhelming emotional surge that you feel is how good it is to be alive.
Right, this disease kills people. There's no sugarcoating it, no getting around it.
I never got to why me, because that to me is a waste of energy. Let's say you answer the question, why me? Then what do you do with the answer?
I sort of had the attitude going in that this was going to be a good thing, and I was probably going to come out better than I was before, which indeed turned out to be the case.
My doctor called it a speed bump. He said this can be a speed bump in life, and it has been. I think one of the things as you start looking at these decisions is everybody talks about, well, here's the downside. This could go wrong, this could go wrong, all these things that can go wrong. The key thing is you end up alive. And you get to go on with your life, and you get to move on, and that to me was the important thing. That's the important side effect, that you get to live.